So PRP, or what they call platelet-rich plasma, is basically a technology that has been used to obtain particular ingredients that we use to rejuvenate the skin and other purposes. It can be used by any age group. We use it mostly in facial rejuvenation. What exactly does it do? It basically enhances production of collagen. It enhances production of new skin cells, of new circulation. It basically rejuvenates most structures on our skin. It is done in a series of 3 to 4 treatments in which we draw some blood, and using a special technology, we harvest what they call the platelets. This is used in special techniques to achieve different goals, particular to every patient. I use very advanced techniques, especially for eye rejuvenation, and I use different techniques where we incorporate the platelets with other products to get really outstanding results. So at a molecular level, it produces growth factors, many growth factors, and these growth factors stimulate the repair. You have to think about it when you cut yourself. Magically, there's a cut, and magically there's new tissue, there's new circulation, there's new nerve endings. It's basically those cells that we harvest, but we control it. And in controlled fashion, we can achieve different goals on different skin types. There are many benefits to plasma. I can really not say enough. It's actually one of the things that I encourage our patients to really look at, because it gives us the most natural change in a patient. Not that the other products are not as efficient or effective, but the platelets are very special. It can be used for many things, including wrinkles, including dry skin, including open pores. We use it a lot for acne. We use it a lot for scars, even for cellulite. So its applications are really outstanding. I can really not say enough about platelets. I really encourage anybody that's looking to rejuvenation techniques to really think about those, about platelets in itself. As the patient comes in for their aesthetic evaluation, a complete physical exam and a past medical history will be done. I may order some blood work, or the patient may sometimes bring their own blood work, and I would determine if the patient is a candidate for the treatment. Most patients are, if they're very healthy and their blood work, their physical has been fine. Most patients can receive the treatments. There are some contraindications, patients that have severe anemia, or patients that are undergoing any type of treatment for cancers. But most patients that are healthy and are looking for a technique, it's really one of the ideal treatments. So the PRP treatment involves the patient will arrive, and we would place some numbing cream on the area that we're going to be working on. And then in about 10-15 minutes, we draw some blood, about 10 cc's of blood. That's processed in a centrifuge machine, and then using different techniques, I would combine it with other products or by itself, and then apply it to the patient's skin. The application to the skin or the internal area of the face is done in different manners depending on each patient. It involves from injections to a device called micropen. It is basically painless. The numbing cream helps. Sometimes I use additional local anesthetics, but most patients tolerate it quite well. Most of the patients I recommend, especially if they haven't done anything at all ever, a minimum of 3 treatments. This is done every 3 to 4 weeks, depending on how much aging the face has. If we're doing also platelets for hair restoration, then we recommend at least 4 treatments. So that's the average, but again, I always recommend a maintenance treatment, especially in patients that are out in the sun or they smoke or a lot of just stress, their skin feels it. So sometimes you can do a maintenance treatment like every 3 to 6 months. There's really no price to what our face is worth. I would say that we give quality products. Our prices are very competitive, and actually the quality we give is probably a great deal. I mean, I use very advanced techniques that are sometimes charged separately at other facilities. I just include it in my core price. And yes, we do have financing opportunities, and we can always do one treatment at a time for the patient's convenience.